Welcome to Working Together for Hudson. I'm Diane Cannava, and here with me today is Gary Gasdia from the school department and Kara Roy, Board of Selectmen. We also have Rob Buxton with us today, who everybody knows is our fire chief in town. He's also in the emergency management group, and he's our town health officer. We're having a special edition of today's show to discuss the COVID-19 situation and get out some word to you people in Hudson. And we're going to start right away with Gary.
Well, thank you, Diane. So I think, as most people know, the Hudson schools are closed for next week. That was a decision that the superintendent made in cooperation really with the CDC, Chief Buxton, the Department of Education, and many of the other superintendents. And the decision was made to close for a period of 1 week. And this will be reviewed on a weekly basis. The plan right now is we'll probably review every Thursday and make the decision for the following week as the situation develops. What I urge everyone is to really wait for official communication from the district. This is a very fluid situation. We're being asked to do things that we've never done before. So in his initial email, it referenced something called remote learning. The way that's going to work is on Monday, the teachers and staff will come in and be trained. There is no school for the students, so they will all be home. And then remote learning will begin on Tuesday. What exactly that is going to look like is being figured out right now. Again, wait for the communication. The good news is that if this goes off as we believe it will, then this will not have any impact to the end of the year schedule for the school. So if we're out a week but we have remote learning, then it's as if we've been in class for the week. One of the questions that we've seen a lot out there that people have asked is about the students who have free and reduced lunch. Meals will be provided to them. Logistically, again, that's being worked out. It will all be in the communication how that works. But this really is something that is unprecedented. The entire staff has worked together really well in cooperation with the town. We had an emergency school board meeting last night, and there were many instances where it was referenced how great it was working with the fire department, the police department, the town officials. There really was no barrier between the town. And then the only other thing is that I think is very important. Our custodial staff, they're in the schools. They are using electrostatic wands that are literally wiping everything down, taking it to a whole nother level. But really want to thank everybody. This is a Herculean effort. And I know everybody wants as much communication as possible. That's understood, but we have to give the people that are trying to figure it out the time to come up with that. So please just wait for the official word. There'll be more communication this weekend as we start to figure out exactly what all this is going to look like. But I really appreciate everyone's cooperation with this.
And they can check the website.
They can check the website. It will be at sau81.org. There'll be information there. And again, as information becomes available, will be sent out via school messenger, and also it will be available on the website.
Thank you, Gary. Kara?
So one of the reasons we chose to have a special edition for this is we want to be a little bit proactive about what the town is doing to manage this virus and exposure to it. We have worked very well. Chief Buxton and the school have been in regular communication since this whole thing started. So that I think that bodes well for us, that we're all kind of on the same page. That being said, Chief Buxton is the health officer for the town, so I'm going to turn it over to him because he has the latest information.
Sure. Good afternoon. Thank you for the opportunity to be here today. As the three previous speakers talked, we've had a great open communication dialogue with the school district regarding the COVID-19 incident, as I'm going to call it. Worldwide, just a couple of updated figures here today. Worldwide, we're at 149,000 cases worldwide, with 5,600 deaths. In the United States, we are now at 2,424 cases. What does that mean for New Hampshire? New Hampshire is what the Governor Sununu calls to be a low risk today. Why are we considered a low risk? We have 7 cases. The 7th case was just announced last evening, and those have been confined to Grafton County and Rockingham County, which is important, and we'll get into why that's important in a few minutes. They've tested approximately 275 people within the state of New Hampshire. 94 of those people, the tests have come back negative. So testing is taking place, and we continue to move forward each and every day, and we get better. On Friday morning of this week, the state of New Hampshire announced that they opened up the Emergency Operations Center in Concord with a partial activation from 7 in the morning to 7 in the evening. And that, basically, what does that do? Basically, that puts all the stakeholders under one roof. Department of Education, Health Department, Emergency Management, all your first responders are in one room, and we're all planning with one voice. And that's very important. As we try to get information out to the public, there does need to be one consistent voice, and that comes from that joint or the incident action plan that's being put together at the Emergency Operations Center. Last night, as most of you saw, the governor declared a state of emergency, which is in line with a lot of other emergency management type functions that take place across the country each and every year. We've done state of emergencies for weather-related storms before, and this is the first pandemic that we've done it for in a long time. I need to be crystal clear about one thing. This is not the first health-related incident that the state of New Hampshire has managed. We've talked about the swine flu, we've talked about the bird flu, H1N1. All of these things have been talked about in the past, and the state has a lot of planning that's been put into that, and their leadership is going to help us as a community continue to be able to provide governmental services, continue to provide education in town, and continue to move forward. So those are important points to make, that we have the ability and the plans are in place, and it's dusting them off and getting them into what is now a new incident and dealing with COVID-19. So I'll open up with that as a start, and I know that you folks have a host of questions, so please help me as we move along here.
So who is most susceptible to?
Yeah, great question, thank you. When we look at the high-risk groups, there are 2 groups that continually come to mind, and they're the same groups that you would look at for the flu season. Our youth, our very young children in the community, and our senior population are at great risk. Why? Because their immune systems are just not built to where they need to be yet. Or they have other health issues that are helping to keep their immune system lower. Respiratory infection, those types of things, asthma, COPD, those folks in our senior population are at greatest risk. So we've asked to have some precautions put into place and move down that path.
So is there a protocol if you believe that you've been exposed or?
Yeah. So state of New Hampshire has done a couple of different things. If you believe that you have a COVID-19 exposure, they've asked you to call your primary care physician. Do not just show up. Do not just show up at the emergency room, but call ahead of time and let them know that you feel you've had an exposure. They have a protocol on the backside, and they'll ask you a host of questions: travel history, medical history, why you feel like you've had an exposure, and then they'll ask you to come in. Most of the time, you're going to get some direction in regards to isolation. So basically come through a side door to the urgent care facility or stay clear of the waiting area. They'll have a specific spot put up for you. And once you come in, they'll make the determination whether they're going to give you the test or not. And that's going to be built off of that questionnaire protocol. Prior to this show, we were talking about the trifecta, as I call it, across the state of New Hampshire right now. We're in the tail to late stages of the state flu season. We still have a lot of flu A and flu B floating around the state. So you have that piece. We also have had a unseasonably warm March to this point, which has also led to allergy season kicking in early. All right, and now we have COVID-19 on the backside of that, which is going to start raising all those respiratory emergencies even more. So we kind of got three things going on in the state. I think it's important to recognize that, we've had 16,000 deaths by the flu this year. We're at just over, 5,000. We need to keep it all in perspective. This is a very dangerous virus that is floating around, but this isn't something we haven't managed before.
So, because you hear things, and I just want to clarify this one thing. Are people allowed to visit people in nursing homes and hospitals and those kinds of things?
Yeah, so on Friday, with the state of emergency being put in place, all of the hospital and nursing home facilities are basically closed to visitors at this point. Fairview closed their visiting hours earlier this week. Basically, if you had somebody in that facility that you wanted to visit, you had to call up and make a request and an appointment. And they're basically doing that to protect our senior population. The bulk of the folks that are in those facilities are our seniors, and we're trying to protect them from the viruses being brought in. Staff is being screened on their way in the door when they show up for their work shift, and those types of precautions are being put in place to make sure we're hyper vigilant about keeping folks healthy.
Does anybody else?
So, I think if you could just talk a little bit, it's been about the reaction that we're seeing at the supermarkets, at all of this. So, you hear things, we need to prepare for a week, we need to prepare for a month. I mean, nobody necessarily knows what's going to happen, but with everything that is the food will be there next week at Market Basket. We don't need to go out and get 5 months worth of supplies. Is that correct?
That's great. I never thought I'd see a run on toilet paper, okay? But that is a reality right now. Is the folks are stocking up and stockpiling, probably back as history has taught us as citizens of this country, that we've done this over the years. It gets passed down generation to generation, right? So you're 100% correct. The food will continue to be delivered. Does that mean that you're not going to have to wait to get your favorite product? Yes, you're going to have to wait. As COVID-19 moves across the country, they're asking us to put continuity of operations plans across business, across government, and in the schools, basically talking about the potential to have 30 to 40% of the workforce being affected. When I say being affected, what does that mean? Affected means there's no school this week and I need to not go to work because I have 2 young children at home. Affected means that I'm self-quarantined because I had to do mandatory travel outside of the country, those types of things. So continuity of operation is very important to recognize that you're going to be able to get your stock next week. Really what they're talking about is 30 days out. What's that look like? And we need to continue to plan that way. I think that everybody is at a raised elevation at this point. And a deep breath is probably at some point in most of our futures to kind of say, okay, where are we at today? We have no exposures in Hudson today that we know of, and no positive cases in Hudson. We don't even have a positive case in Hillsborough County. So what does that mean for us, and how do we continue to function our normal lives? One of the things that is keenly working in New Hampshire, they've asked folks to self-quarantine, social distance, and make sure that they are isolating, and that is working. We have not seen any growth out of the 2 counties, Grafton County and Rockingham County. So there has not been anything attached to a community transmission, meaning that we're sitting here in this room and we're transferring to the 4 of us. It is a very contagious disease and a very contagious virus. They reported out last week that 1 person could potentially affect 2.5 people. So, those numbers are there. But as contagious as it is also a very fragile virus, meaning that it needs water droplet, it needs moisture to continue to live. Once it dries out, you wipe it off with a rag. Common practices are cleaning surfaces, washing your hands 20 seconds at a time, making sure that you have proper respiratory etiquette. If you need to cough into your arm. Don't golf all over the table or counter, right? And good practices that we see in New Hampshire every flu season. You know, we talk about some of this stuff routinely. And some of the conference calls that I've been on, they've actually talked about the fact that they don't expect the United States to have a big peak. Yes, our numbers are escalating right now. On February 13th of this year, there was a spike of 15,000 cases in one day. They're not expecting that at this point. And that's because we have practices that are important. We wipe down the surfaces. We have hand sanitizers within public places and those types of things. We just need to stay vigilant to getting that accomplished.
And just one more question. So there's no school.
Mm-hmm.
A lot of people have been told they're going to work from home. Like, what does that mean in practicality, though? Should I go shut myself in the house for the next 2 weeks, or can I go out and to dinner? Can I go out and do something?
Yeah, so I think that's an important question, right? Teleeducating. My wife is an educator, and you know, what does that mean? We don't have school next week, so everybody's like, "Oh, we get a week's vacation." No, we're not heading to Florida. We're not having big gatherings, but that does mean you can go out in your yard. You can go out and you know, go out to dinner, grocery shop. Maybe you pick a different time. Every Thursday night, you and your husband, you and your wife go food shopping at 5 o'clock. I don't know. Maybe you're going at 8. One person's going at 8 o'clock that night. Limit your exposure. That's going to be important. And those are the social distancing techniques that we've talked about. So I think that is key.
Can you just define social distancing?
Sure. Social distancing is a couple of different things. One, your ability to make sure that you have 6 feet of distance between you and another person. Make sure that when you're engaged in conversation, if you need to cough or sneeze, that you're covering your mouth. Make sure that you're not right up in somebody's face. You're not sharing microphones. You're not shaking hands. And that's tough for us as a culture in the United States, right? We commonly will enter in and we will have conversation and shake hands with somebody when we greet them, especially in business practices. Those things we're not doing at this point. So those are important. That's the type of stuff that we're talking about. And if, you know, openly, if you're not feeling well, stay home. Don't come to work. Those are things that, you know, it's very important for people to recognize. You know, I have young kids. Sick leave is very important to us. But, you know, my wife and I are probably a little more vigilant than most in regards to, hey, if we're not feeling good, we're taking a day off. And if they're not feeling good, they're not going to school either. And those are the important practices that need to be continued.
I did notice online that there was something from the fire department that stated if you need 911 to alert you people.
Yep. So first responder exposure, everything we've talked about to date is pretty much hospital forward. But what we're looking at is what's our first responders doing. All of the 911 calls in the state of New Hampshire are answered in one of 2 locations, either in Laconia or in Concord. When you answer the phone at 911, they're going to put you through a host of questions. You call in with a respiratory issue, they're going to ask you a bunch of history questions. How long has it been since you've traveled? Have you been on a cruise? Have you had an exposure to somebody with COVID-19? And they're going to pass that down to the first responders. And when the first responders show up, you're going to see our practices be different. You're going to see one person enter the house and get in and engage the patient. They're going to have a mask on. They're going to have a gown on. They're going to have gloves and eye protection on. And that's basically to protect them from the exposures and not getting those droplets on them. And then the next piece is to get a mask on you. So basically confine that exposure across the board and call for what they need for equipment coming in. So we're not contaminating the ambulance. I'm not contaminating all of our equipment on the backside. So those are important pieces. A great question on your part.
Good for everybody to know that.
Yeah.
So I have, well, I guess Chairman Moran sent you an email about food pantry. I didn't write down the details.
Sure,
so if
sure.
you wanna-
You ready to get into that?
Yeah.
Okay, so Chairman Moran asked us to share a couple of different things this afternoon. The Hudson Food Pantry has put in a temporary distribution procedure for operation during the COVID-19 outbreak. Clients who will be receiving an email from the Hudson Food Pantry outlining the new pickup procedure. These distribution procedures will remain in effect until after the passing of COVID-19. The Hudson Food Pantry is here to assist any of the residents of Hudson in their time of need during the COVID-19 outbreak. Residents find themselves in the need of assistance. The pantry asks that requests for assistance go through the town's welfare office or the school department. They're asking you not to come directly to the pantry, but to make sure that you're having some conversations so you can line up your pickup. Also had conversation with the director of the library today, and they're postponing all group activities at the Rogers Memorial Library today. They will remain open and stay available for the public to go and pick out a book. Well, we're off from school, so we're going to read a book, which is going to be important. Access to online services, I believe, there also, so that they have some capability there to give a hand. One of the things we have not talked about yet, I think is very, very important. If folks in Hudson need information regarding COVID-19, the state of New Hampshire has stood up a 211 line. So any resident in the state dials 211, they're going to get directly up to a joint information area for the state of New Hampshire, and basically they can ask their question. One of the things that they have encouraged, they are not on this line for diagnosing, and they are not on the line for medical needs. They're on the line for providing information to the public regarding how to stay vigilant, where we're at as a state. Be able to push you in a direction if you feel you've had an exposure in regards to where you need to go. So 211 is a very important line. Continue to check out the Town of Hudson, hudsonnh.gov website. Right in the top of the banner, you'll see a spot where you can click right on there, and that will bring you to the health page underneath the Hudson Fire Department, and you'll see a lot of information in there from the CDC. One of the things I expressed prior to the show was quality of information for the public. Please make sure that you're going to either the CDC or who's the World Health Organization, to get information regarding COVID-19. This is not something to be fooled around with or managed through social media. This is something that you need to get quality information to make sure you know your exposures or how to prevent your own exposures. There's information on there for the schools, the public, healthcare facilities across.
That was actually going to be my last question.
Oh, okay.
Okay, about contact information, but
Okay.
yeah, that's right now. That's all I have. Do you folks?
Yeah, no, I just think one thing about the food pantry, they're gonna need donations too, right? So, there's a lot of, back on Facebook, a lot of people said, I'd love to donate. Do you need help? Do you need help? Which is great. But the food pantry is there. There are gonna be a lot of people that do need help, so make your donations to them as well.
Yeah, if I could just fill in maybe one last detail. What are we doing as a town? What are your department heads doing on the backside? We talked about the state and what they're putting together. This Wednesday, department heads will start meeting as an emergency management group and trying to stand up exactly what does it mean for services, not just first responders, but town clerk's office, assessing, building department. How do we continue to function, and what's our continuity of operation plan to continue to provide rec services in the library and those types of things to make sure we continue to move forward as a government and provide you the services that we need to.
Very good. Well, this was our initial attempt at getting some communication out ASAP. We thought we should do this. We'd like to do this weekly as things come through down the pike here. We want to thank you for coming today. It was very important to have an official here with someone that could put you at ease with the facts and be a face for Hudson when we look at the television and we get information, that it's local information and it's for the residents. I want to thank you, Kara and Gary, for being here today also. And that's it today for Working Together for Hudson. And we will see you again our regular show, but we will be putting in these special editions weekly, if not more so, whatever we need to do for the town. Do not forget 211 is the hotline, the CDC online, and also the World Health Organization. Those are the most reliable sources for information. Thank you very much. See you again.